Hello guys, this is Indian Medico, and in this video we are going to discuss about corneal collagen cross-linking. Corneal collagen cross-linking is abbreviated as CXL. Collagen fibers cross-link naturally during maturation and aging. In human cornea, this process can be modified by using topical riboflavin followed by exposure to UVA light. As you can see in this picture, after CXL there is more cross-linking of collagen fibers in human cornea. Coming to the indications of corneal collagen cross-linking, it is used in stabilizing progression of keratoconus and secondary ectatic responses like post-LASIK or microbial keratitis. It is useful in fine-tuning results of previous refractive surgery like intrastomal rings and photorefractive keratectomy. It is useful in reducing spatial separation of collagen fibrils in edematous stroma like in cases of corneal decompensation. Now let us discuss the method of CXL. It was described by Olensak et al. And it is called Dresden protocol. It is effective and safe. Under topical anesthesia, the central 9 mm corneal epithelium is removed. The surface is treated with 0.1% isoosmolar riboflavin, that is vitamin B2 solution, every 1 to 5 minutes for 30 minutes. In this picture, the yellow solution is the riboflavin. The central de-epithelialized cornea is then exposed to calibrated UVA, as you can see in this picture. The wavelength of UVA is 365 nanometer. The energy intensity is 3 milliwatt per centimeter square, and it is delivered at a distance of 5 millimeter from cornea for 30 minutes. The total fluence is 5.4 joule per centimeter square. There is something called accelerated Dresden protocol. In this case, you increase the energy intensity to 10 milliwatt per centimeter square and you reduce the time for 9 minutes. This again delivers a total fluence of 5.4 joule per centimeter square. Pachymetry should be done. This is because the minimum safe corneal thickness for treatment is 400 microns and this should be ensured. The procedure is completed with instillation of a topical broad spectrum antibiotic and a therapeutic contact lens. Coming to the long-term outcome of corneal collagen cross-linking, there is delay in progression of disease which has been shown in many observational studies following collagen cross-linking. Randomized control trials suggest sustained efficacy of treatment, although a Cochrane review noted the need for improved trial design in such studies. Now let us discuss the complications of CXL. The incidence of complications following CXL is low. The reported complications include epithelial defects, infective keratitis, corneal mills, and failure of procedure, that is progression following treatment. The complications are more likely when the age is more than 35 years and in cases of very steep pre-treatment K values of more than 58 diopters. So there is higher efficacy and lower failure in younger patients with progression rather than established advanced keratoconus. This is summary slide of CXL. Coming to the basic concept of CXL, as you can see in this picture, when human cornea is treated with riboflavin, UVA and oxygen, the post-CXL cornea will have more cross-linking. The procedure of CXL is Dresden protocol, which was proposed by Olensak et al. In 2003. The variations in UVA delivery include accelerated CXL and slit lamp CXL. The variations in riboflavin delivery include epithelium off CXL and epithelium on CXL. Coming to the effects and safety of CXL. CXL acts in the anterior stroma of cornea, so there will be keratocyte apoptosis and replacement. In CXL, the limbal stem cells are safe and the corneal endothelium is also safe. Coming to the uses of CXL, it is useful in keratoconus, pellucid marginal degeneration, post-LASIK ectasia, packed CXL, which is useful in cases of keratitis, and PBK. Coming to special situations, in kids, CXL is safe and effective. In thin corneas, we can use hypoosmolar or higher concentration of riboflavin. CXL is contraindicated in pregnancy and keratoconus in pregnancy should be observed. Coming to the advances in CXL, the various advances include pulsed CXL, adapted fluence CXL, CXL plus, that is CXL combined with refractive surgery, photorefractive intrastomal CXL, scleral CXL, LASIK extra, that is when CXL is combined with LASIK. The complications of CXL include corneal haze, infection, pain, persistent epithelial defect and corneal mill, and failure of procedure, that is progression of ectasia. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.